Hello, my name is Betty Neuman. I was born in 1924 to a farming family in the village of Lowell, Ohio. My rural upbringing led to my strong compassion for those in need. My personal philosophy is simple: helping each other live. In 1947, I received my registered nurse diploma from People's Hospital of Nurse School of Nursing. From there, I went to UCLA and received my master's degree and then went to Pacific Western University for my doctoral degree. In the 1960s, I began to develop my model, and in 1988, I funded a group of trustees to help guide my model in nursing practice as well as research and education. My model is considered a grand theory. It is constantly changing to fit the needs of patients. I use the term holistic with a W because my model focuses on the patient as a whole, including mind, body, and spirit. My model is used to help individuals, families, communities, and society reach and maintain wellness. My model focuses on 5 variables of an individual. These include psychological, physiological, social, developmental, and spiritual. These variables make up an individual's core structure. They are protected by a series of outer barriers. If the barrier becomes penetrated by a stressor, the individual moves towards illness on the health and illness continuum. My model describes health and wellness as a condition or degree of system stability. If a stressor threatens the stability of the system, the individual moves towards illness on the continuum. The degree of illness is then determined by the amount of instability. My model is widely used in nursing practice. Using my model, the nurse is assessing the individual by identifying potential and actual stressors. The nurse then goes on to consider the presenting client circumstance in terms of primary, secondary, or tertiary prevention. Primary prevention are potential risks and hazards. Secondary prevention is looking at the reaction of the stressor and finding resources that would be useful in resisting these stressors. And lastly, tertiary prevention is considering the level of stability following a period of treatment and identifying the factors that could lead to a relapse back into illness. There are 3 types of stressors: extrapersonal, interpersonal, and intrapersonal. Extrapersonal factors comprise all interactions occurring outside the client. Interpersonal factors arise from interactions between 2 or more individuals, and intrapersonal factors include interactions contained within the patient. These stressors either have positive or negative outcomes and can push individuals towards health or illness. My model was used in a study assessing chemotherapy-induced nausea and vomiting in women with breast cancer. Using my systems model, researchers were able to identify desired nursing outcomes for clients with breast cancer experiencing chemotherapy-induced nausea and vomiting. It also helped explain diverse chemotherapy side effects, as well as the nurse's role in assisting patients towards health. As a result of the study, effective primary, secondary, and tertiary preventions as a nursing intervention can be developed. Using these lines of prevention, the impact of chemotherapy will not affect the level of stability or affect it to a lesser degree. Although widely used, a real-life example of my model being used was when I was observing in the emergency room. A patient came in with flu-like symptoms. The nurse assessed the patient and used the different levels of prevention as interventions to treat her. Since the patient was already experiencing symptoms, secondary prevention was the initial intervention. The patient was given antiviral medications, fluids, and encouraged to rest. Tertiary prevention was initiated before discharge, when the patient was advised to slowly go back to her routine, so the body could recover and return back to its normal balance. Since this was an acute illness, returning to primary prevention is the goal. The patient was taught the benefits of the flu shot for the next flu season. In conclusion, my model supports my belief that a holistic perspective on human beings is essential, especially in healthcare. If one of the 5 variables is compromised, the whole system becomes unstable, which leads to illness. Using my model, interventions can be established that are specific to treating many individuals with many different needs.